Hi, everyone. Thank you for joining us for our monthly health and wellness seminar. It is one of our many support offerings here at the Margie Petersen Breast Center. If you're watching this on YouTube and would like to watch future recordings live, we meet every third Thursday at 11:30 Pacific time. You can also find a Zoom link in the description box below. Um, my name is Alston Novak. I will be our moderator today. Um, we want to acknowledge the donors who help support all of our programs, especially the Ken Johnson family in memory of Joan Brierton Johnson. And this month, we are grateful to have Rebecca Crane-Okada here from Providence. Um, she will be talking to us about balance and harmony, complementary practices for self-care. Go ahead, Becky, take us away.
Thank you. It's a privilege and a pleasure to be here today and talk to you about this subject that's close to my heart. It's going to be a whirlwind tour, and there will be a lot left unsaid, but hopefully it will prime the pump and encourage you to look for things that might be of help to you. So my objectives for you are that you will learn about complementary health approaches, broad sweep, reflect on what complementary health approaches might help you in achieving better balance and harmony in your daily self-care, learn what to consider when seeking such care, and commit to something you can add to your daily self-care routine. So we all have barriers to self-care, and I hear this a lot as a nurse, helping people with breast cancer. Everybody else comes first, whether it's children, partner, job, family, everybody and everything else comes first. There's lack of time. I don't have time to sit still. It's a waste of time to sit still. Or sometimes a belief that everything else will work itself out, and I'll just give it some time. Meanwhile, there is a level of suffering that's taking place, and perhaps a level of suppression of one's need that is taking place. Perhaps there's a lack of reliable information or a lack of knowledge of where to get good information. Sometimes when we seek change in ourselves, it causes changes in the world around us. And so there may be an associated fear of loss or change in one's relationships. If I get help, what does that do to the rest of the situation? And a lack of support. Sometimes friends and family say, oh, that stuff is woo-woo. I'm sure you've not heard that. Or the stigma associated with perhaps seeking therapy, like, I should be able to handle this. I'm much stronger than this. Or our family doesn't do therapy. So these all can be barriers. They're all probably pretty normal. And maybe we have all of these or one that stands out, but I want you to just think about what are some of your barriers to self-care. Here at the Margie Petersen Breast Center, we have a wellness program called the Willow Sage Wellness. And these are the pillars that I like to think we focus on, which is nourishing the physical, the mind, the spiritual, the social, which is often through community of like-minded individuals, and the whole. This quality of life model developed by my colleagues, Betty Farrell and others at the City of Hope, is a model that I use to focus my attention on a person's wholeness, looking at their physical well-being, their social well-being, their psychological and spiritual well-being. And if you think about this, the experience of breast cancer affects potentially any of these areas. And if one is heavily weighted by physical symptoms or even just going through surgery, then it's going to take away a little bit from some other areas, or it may cause one to look at some of these others areas more carefully. So I think this is a good model to look at the interrelationship of all of these aspects of our well-being. And when you think about living with, during, or after a diagnosis of breast cancer, I like to think of this as a time that may be an opportunity to renew, to restore, to make like new, to begin again, to really reevaluate, and to integrate into a unified whole. Maybe a better integration or an opportunity to integrate. So things to know about stress. It's normal to have stress. We live with stress every day. It may be physical, it may be mental, it may be emotional pressures. When we experience stress of any kind, and the diagnosis of breast cancer is a change physically, and it causes adaptation through surgery, chemotherapy, hormone therapy, radiation therapy, not to mention the mental and emotional changes. But stress hormones are released, and it causes physical changes in the body. The blood pressure, the heart rate, the breath rate all go up, as does blood sugar. And the body's preparing for this fight or flight response in response to something stressful. You compound that with negative coping, which may come from bad habits, such as smoking, overeating, overdrinking. Chronic stress suppresses the immune system, and we really don't know what happens with chronic stress, but we do know that it does contribute to or worsen some health problems like digestive, headaches, and sleep. And it's unclear how or if chronic stress may affect cancer development or recurrence. But we also know that chronic stress is not good overall. So whatever we can do to reduce chronic stress, we want to try and find ways to manage that. Certainly, occasional stress is a good thing. It keeps us on our toes, it helps us, but chronic stress is not so good. So if you think about general definitions, conventional medicine is what we do in healthcare, in the hospital setting with allopathic or biomedical strategies to treat diseases or disturbances in one's health, also known as Western medicine. Complementary medicine or therapies or approaches are those that are used as a complement, generally seen as a complement to those other conventional medicines. And then integrative is another term for medicine, therapies, or approaches that really bring the two together and try to blend the best of all to help one's healing. So I think it always causes us to ponder, what is medicine? What is healing? What is wellness? And what is health? And I think there are many definitions, and yours and my definitions may not be exactly the same, and they may change with time and with the confrontation with illness. I like this quote from a book by Jeannie Ochterberg, Woman as Healer. She says that healing is a lifelong journey toward wholeness. It's remembering connection, unity, interdependence among all things, embracing what is most feared, opening what has been closed, and softening what has been hardened into obstruction, entering into the transcendent, timeless moment when one experiences the divine, creativity, passion, and love, seeking and expressing self in its fullness, light and shadow, masculine and feminine, and learning to trust in life. And Arian, in the Fourfold Way, describes these common healing principles across all cultures, which are having a balanced diet, having regular exercise, integrating time for play, fun, and laughter, incorporating music, singing, chanting, or dancing, love, touch, relationship, and support networks, engaging in creative pursuits in work and leisure, time spent in nature with beauty and in a healing environment, and having faith and belief in the sacred, spiritual, or the unknowable. So as you think about this and reflect on these ideas, it again is a challenge to help define for you what is your self-care journey in health, healing, and wholeness. So I give to you some definitions, and in looking at this again recently, because I'm always kind of trying to keep track with the National Institute of Health, both the National Center for Complementary and Integrative Health and the National Cancer Institute, how they each define complementary therapies. And right now they have two broad definitions going. So I'm going to give you these just to think about, because when you hear about complementary or integrative therapies, you may hear them referred to in different categories. So the NCCIH defines 4 categories of nutritional, psychological, physical, and combinations of the above. And the National Cancer Institute describes mind-body modalities, biologically based, manipulative and body-based, energy healing, and whole medical systems. And you can see in the slide how things fit into each of the categories. And I'll be talking about those in just a moment using the National Cancer Institute definitions. But I also wanted to bring up the combinations of therapy that the NCCIH describe actually overlap with all of the NCI designated categories. Practices of traditional healers, which include Ayurvedic medicine, traditional Chinese medicine, which includes herbs and acupuncture and acupressure, homeopathy, naturopathy, and functional medicine. So using the NCI categories, I wanted to bring up some things that we'll talk about briefly today. And those mind-body modalities, which most of us have heard about, include meditation or mindful meditation or mindfulness, biofeedback, hypnosis, which includes self-hypnosis, imagery or guided imagery or things like body scan meditation, yoga, and two forms of Asian movement and meditation known as Tai Chi and Qigong. And then there are the creative outlets of art, music, dance, journaling, or writing, which can be self-directed or professionally directed. And three organizations that provide professionals training and certification include the American Art Therapy Association, the American Dance Therapy Association, and the American Music Therapy Association, all who train and certify professionals in using these creative outlets as therapeutic efforts for coping with stress. And if you haven't heard, two newer modalities that are getting a lot of attention are sound healing or sound baths. And with the idea that the sound actually emits vibrational or tonal vibrations that may be heard and may be felt, but may also not be so visible. And they are often meditative and allow one to focus. I put healing in quotes because I have a pet peeve with the word healing. I think that sometimes when we use the word healing, we think that something is going to change as a result of the intervention, whether it's sound or touch or medicinals or herbals. But I see healing as something that we hope to facilitate through these modalities and allow the body's own mechanisms to stabilize and promote healing. But the actual method that we use is not a healing modality. It doesn't cure the situation. And then another one is Shinrin-yoku, also known as forest bathing. This was developed in Japan, and there are now national organizations that are training in this, and it is designed around the idea of immersing oneself in nature. And it's more than just walking in nature, but it may be a guided process where you are experiencing the forest or nature in a way that allows you to reflect, observe, experience, and be transformed as a result of that experience. So I put here a link to where you can get more information. HeartMath is something we offer here in the Breast Center. It was designed as a modality to help people see, similar to biofeedback, the response in their bodies physically, in their heart and breath patterns, the response to stress, with the premise that emotions such as frustration and anger are depleting and lead to disorder in the nervous system. Renewing emotions such as appreciation, compassion, and gratitude allow for a more coherent state. And with the sensor that is applied to the earlobe or the finger, one can see tracings of the respiratory rate, the heart rate, and the blood pressure here in this screen, where there is quite an extensive variability under stress. But with calm and focus, one can change that variability in the heart rhythm pattern or recalibrate it and create physiological coherence or harmony in the mind, emotions, and the body. And again, there's a QR code and a link to the website to get more information. So you would be learning self-regulation through increased awareness of your own stress response and how to change that response. I want to refer you to a couple of mindfulness recordings that we did previously, because mindful walking in nature can be done in a labyrinth or just in one's neighborhood. And in two of these, we discussed other techniques. So in May of 2023, I included an emphasis on mindful walking in the labyrinth. And in October of 2022, I included the emotional freedom technique or tapping, which are additional mind-body modalities. The biologically based complementary therapies include vitamins, dietary supplements, botanicals, special foods, or diets. And we've tried to bring in health and wellness recordings of our nutritionist, Yarouj Riaz, addressing some of these. And one she did in May of 2022 is still alive and well on YouTube, and it really goes into more depth about common dietary supplements and breast cancer. She has done others on seasonal produce, mindful eating, and she'll be doing one next month on eating healthy through the holidays. So I'm not going to spend time today. This is a huge field and is more than I can address today. So manipulative and body-based modalities that can complement one's self-care include massage, and certification or licensure for massage therapists varies by state, county, and/or city. The Society for Oncology Massage provides additional training to massage therapists designed around how to help people going through chemotherapy, recovering from surgery, and there are a few Society for Oncology Massage therapists in the LA Basin, but you can also go online and find those anywhere in the United States. Chiropractic, body-based and manipulative therapies, these are licensed doctors of chiropractic, and they have extensive training in manual therapy, spinal manipulation, nutrition, exercise, and other methods. They are licensed as such and can bill for their services and may or may not be covered in their services by your insurance. So that's worth checking. Reflexology you may or may not have heard about. Certification is optional, and the American Reflexology Board does do this certification. It is not required in most areas to be certified. It is a technique that uses different levels of pressure applied to specific points on the hands or feet or the outer ears, with the idea of stimulating the complex neural pathways linking body systems and supporting the body's effort to function naturally and optimally. So this may be something to explore. It is considered to be very relaxing. And for those who are sensitive in their feet or hands, this may not be something that you'd want to do, but you could still try it on your ears. And you might want to consider that. We do not offer that here at this time. The M technique was developed by a registered nurse, and she chose to develop it, calling it the M technique, because while it's similar to massage, it is very different, and it does not require massage therapy training to do this. And the touch is done in a specific sequence, repeated as a set number of times in a set pattern at a set pressure. And that pressure is usually 3 out of 10, with 10 being very firm pressure. The purpose is simply to relax. I had a student recently who was offering this, and it was just done on the hand and forearm, and most people found it extremely relaxing. The idea is that you're contacting skin receptors, and that sends signals to the brain to put it into a relaxation state. It's a kind of meditation. Some people have described it as physical hypnotherapy. But again, knowing that this is a set pattern, a set number of times, and a set pressure allows one to relax more into it. With massage, if you've never had a massage before, that first time you're wondering what's going to happen next. Once you've had more than one massage, you kind of get into the routine. The M technique allows this to be done pretty quickly and adapted to. Now, energy healing is another modality. 3 broad areas that you've probably heard of maybe have heard of. Reiki is the most widely known. It is a ancient art of connecting universal energy from the practitioner to the individual. It is not the practitioner's energy that is being connected, but this universal energy that is in the world, and allowing that person's energy to flow more freely, with the idea that energy is trapped as stress and trauma, whether that stress is physical or emotional, and it can cause energy to be trapped, and Reiki allows the flow of that energy more freely. It can be done usually on the body as a light touch or at a short distance from the body. And again, the purpose is to promote harmony and balance in the body's energy flow, and usually results in deep relaxation and overall well-being. Therapeutic touch and healing touch were developed with nurses, and our certification programs, you will find these practitioners throughout the United States, similar process, similar technique, various changes that are unique to those fields. And then our whole medical systems, or the traditional, as mentioned with the NCCIH guidelines, include Ayurvedic, traditional Chinese medicine, and naturopathy. So if you think about, again, the idea of the body has energy fields that flow, and all of these have in common that idea of energy. Ayurvedic medicine is a traditional medicine that aims to cleanse and restore balance. And this is often done through the use of diet, herbs, exercise, meditation, focused breathing techniques, physical therapy, yoga, and many others. And I'm hoping we can have a talk by an Ayurvedic practitioner sometime in the 2025. Traditional Chinese medicine is done, they call it qi, or energy that flows along the meridians. The aim is to restore the balance between the yin and the yang. And acupuncture is part of traditional Chinese medicine, as are herbs. And you can find a wonderful lecture by Elizabeth Fine from last year on acupuncture, and she does talk about traditional Chinese medicine as part of that. And naturopathic medicine, again, has the aim to help the body heal itself. And they stress an emphasis on natural agents such as air, water, light, heat, and massage, along with herbs, nutrition, acupuncture, and aromatherapy, or the use of essential oils. Naturopathy is a national accreditation program, and practitioners are naturopathic practitioners or physicians. And one of the more common training, well-respected training programs is at Bastyr University in San Diego. So I want to close in a short minute with 8 things to know before you consider any of these complementary modalities, is to talk to your healthcare provider before trying any approach. No complementary health approach has been shown to cure breast cancer or cause breast cancer to go into remission. Acupuncture has been proven to help reduce pain, fatigue, nausea, and vomiting, and there is new evidence that supports its value in acupuncture, the value of acupuncture in reducing hot flashes. And when I mention pain, I am referring to also the joint pain and the muscle pain associated with anti-estrogen agents. Hypnosis may help reduce pain, nausea and vomiting, and hot flashes, and help with anxiety and distress related to medical procedures. Relaxation techniques do help reduce anxiety, and they may help one feel a sense of deeper calm overall. Mindfulness-based strategies may help one cope with stress, anxiety, depression, and fatigue. Practicing yoga may help with fatigue, sleep, depression, anxiety, and quality of life. And most of this work has been studied in women with breast cancer. And there's beginning research evidence that suggests that massage therapy, reflexology, Tai Chi or Qigong, and music-based interventions may help people with symptoms and treatment side effects. And I say all of this because this is research that says what they do. But without research, you can still think about what helps you get through your days, helps you refocus, and helps you take care of yourself. So I end with, it's important to have a personal plan, to tend your body, to think about exercise, monitoring weight gain, eating well, getting enough sleep, keeping up to date with your checkups, breathing. Simply the technique of breathing helps. Tending your mind, write down your questions or worries and follow up. Learn or create something new for yourself. Investigate what you're curious about. Share your thoughts and ideas with others. And tend your spirit. Reflect, pray, commune, dance, sing. Do what gives you joy. Be present with yourself and for yourself. Be with nature and always unplug. This is a very stressful time of year, compounded by the elections. So please take care of yourselves. So I thank you, and I invite any questions from the group.
I just was curious. I've heard Reiki and therapeutic touch used interchangeably. Can you tell me a little bit about the difference between the two?
I am not trained in therapeutic touch. I believe that they are very similar.
Okay.
There may be nuances to the method in which touch or off-body contact is made, and Reiki has a process of using some other techniques for the practitioner to prepare themselves for offering the Reiki.
Like the
So
Reiki, I think, requires an initiation. Does the therapeutic touch do the same thing?
therapeutic touch is a certification program that's done over several modules, and Reiki is done as a mentored training that is levels. So level 1, 2, and then master teacher, and then master Reiki practitioner.
Okay. Yeah.
So you can find out, level 1 is preparing people to offer Reiki on themselves, and level 2 brings it up to offering it to others.
Okay. Thank you.
Thank you.
Nice to see you.
Thank you. Same here. Check out our website if you're interested in seeing our nurse practitioner in our breast health clinic for just common everyday problems or concerns or screening. The phone number is shown. And for our multidisciplinary breast cancer clinic, this is the number to contact us for a consultation. So thank you all for being here today. Bye for now.